basic EFT stuff. I mean, I know it's an obvious question with you, but how did you come across EFT?
All right, so the story goes that I was in Australia when Karl came across EFT himself and then started to train in it. And he rang me a couple of times, actually. And I remember him ringing me and saying about this EFT. That, you know, at the time I was kind of nursing. I had a young family. I was a housewife that did everything. And, you know, for somebody to go this tapping thing, I was just like, eh. And I did that a couple of times, like just didn't hung up on him. But you know what I mean? I was just like, yeah, right. And then he had just worked with a lad who was about 17, who had suicidal tendencies, addicted to Coca-Cola and anorexia. See, I even remember distinctly, and this is going back like 13 years now. Now, Karl said, you know, I worked with this lad for like 8 weeks, and in that time, he now was kind of back into life, you know, getting a job that he could keep, getting a girlfriend and da-da-da. And, you know, in that moment, what that did was it triggered me. You know how sometimes you hear things and it just sends you on a spiral or yeah. And I literally went da-da-da-da-da all the way back to when I first started my nurse training. And I was working on a medical ward. I was like literally a student nurse. And for some reason, we happened to have at the same time 2 young girls on a medical ward. You know, the Nightingale wards in England, yeah? And they both had anorexia. But how were we treating them? We had them on bed rest. They couldn't even go to the toilet, so then they had to use bedpans with just a curtain dividing them from everywhere else in the ward. And there would have been male and female, because we didn't just have single sex wards. We had to watch them eat, basically control them. And if you know anything about anorexia, you know, the one thing it is about, yes, there can be a belief of I'm fat, but it's all about control. And so we were controlling them, which would have been triggering them to, and it's almost like I had this knowing. It's like this revelation, like, what were we doing? And that's when I said to Karl, I mean, here I am, Karl saying, you know, he's just worked with this 17-year-old with EFT. And then it's like I did this automatic, all in an instant comparison to how we were treating them in the hospital.
Yes, exactly. Yeah.
Do you know what I mean? And I'm like, I'm in, because I want to know how you did that. You know, so that's
when you say how you did that, what did you see him do?
I didn't see him do anything. I was just listening to the results.
Right. Yeah.
You know, that somebody was suicidal, anorexia, okay, Coca-Cola addiction, big deal compared to the other stuff, but still, all of that had disappeared in 8 weeks.
Yes.
So I don't know, it was just this higher knowing. I know it was.
Yes.
You know what I mean? Yeah. Just this knowing that, Caroline, you need to look into this.
Yes. Yeah. Excellent. So, okay, so then you went ahead and learnt it. What was your experience in training in that? Did you have any insights, breakthroughs?
Well, what happened was Karl came to Australia, and this was in 2007. So there was myself, a few other nurses, and a couple of people had found him from his website. So they joined us. And I must say, like, just going back a bit, I was watching other EFT stuff, like, you know, Gary Craig's great, but I was kind of watching the demos and everything. I was like, oh, it's a bit complex and everything. But when Karl came and taught it, my breakthrough, I guess, was like how simple EFT could be. You know what I mean? So when he came, I was like, oh, I really, really like this, because it was simple, straightforward. You're just getting the client's answers and then you're tapping for that. Yeah. And let's not forget that it was at my house, because it was at my house, actually, the training, that's when he had the experience with the lady who had an issue that she didn't want to express the memory. And then Karl said, let's do the tearless trauma technique with her. And then it was that moment at my house where that lady said, my little girl was so clear I could tap on her. So that actually is the start of Matrix Reimprinting, which is no coincidence. Yeah. No coincidence that happened, because now EFT and Matrix Reimprinting is my life.
Yes.
You know, so Yeah, it's like, I don't want to be without it, do you know what I mean? As a career and on a personal level.
Well, exactly. It kind of answers another question about how going forward from there, it affected your personal and professional life and career, complete change of career after many years of nursing.
Yeah, well, admittedly, at the time, so this is 2007, I was a community nurse, and what was great was, because we're autonomous and we're going into people's houses, I would come across people who had a pain issue, and I was just like, oh, nurse, you know, my pain's not going away. And if I had a bit of time, then I'd say, look, I'll do this technique, you know, would you like to give it a go? And you know, people, when they're in pain, they'll try anything. So I would just do like EFT on the pain, and you would literally see their energy shift, you know, and so that was amazing. And then I'd have, you know, sometimes I'd have a bit of extra time when I used to take student nurses out, so they'd be there doing all the paperwork, and I'd be like, oh, I've got a bit of extra time, do you want to do a bit of this tapping thing? So it was great, you know, so that was kind of my early days of practice, really.
If you would like to know more about EFT, please subscribe to my channel and click the notifications bell. Thank you for watching.